Ireland. Ireland's healthcare system is similar to the U.S. healthcare system in that both public and private sectors exist. The public healthcare system is funded through taxation and managed by a governing body known as the Health Service Executive, or the HSE. According to the Statista website, residents of Ireland are able to receive public health care services if they have lived in Ireland for at least 1 year. Citizens able to receive services through the HSE may have either full eligibility or limited eligibility. Full eligibility can be described as Category 1, while limited eligibility is Category 2. Category 1 is any person with a medical card. This medical card entitles the cardholder and usually their dependents to many free health services like general practitioner visits, drug and prescription medicine, hospital services, dental, ear, and eye services, maternity and infant care, community care, and personal social services. Approximately 37% of citizens in Ireland have access to full eligibility. Category 2 is referring to all non-medical card holders. All non-medical card holders are also entitled to the public health care services provided by the government, but have to pay a fee for some of the services. For example, if a citizen needed emergency care, it would cost about €100 for a visit. However, maternal services and care for the child until 6 weeks of age is free, and the cost of prescriptions are subsidized. Ireland's public system also provides something known as a GP visit card to people who are barely above the income qualifications for a medical card. Using this card, citizens are able to visit the general practitioner free of charge. All children under the age of 6 and adults over 70 can visit the general practitioner for free anyway. Many citizens tend to utilize the private healthcare system in addition to the country's universal health services. Private healthcare may be paid for out of pocket or by an employer. People tend to use the private insurance to cover any costs that the government doesn't pay for and to decrease the wait time for medical services.
Medical school in Ireland is about 5 years. After attending med school, they must complete an internship year and then an additional 2 years to become a certified general practitioner. If they wish to pursue a specialty field, an additional 4 to 6 years of training is required. Medical school in Ireland is free for all European Union citizens. A key difference between the U.S. and Ireland's medical school training is that in Ireland you have the opportunity to attend medical school right out of high school. As the population has greatly increased, so has Ireland's life expectancy. The life expectancy in the 1960s for men was about 68 and for women was 72. Now men live to about 75 years and women live to over 80. The overall health of the population in Ireland is better than most European countries. Smoking is one of the biggest concerns, however, accounting for the deaths of 300 in every 100,000 people. Cancer is another major concern. Ireland has a much greater mortality rate for breast cancer than the European Union average.
People of Ireland have this belief that when it comes to their health care, they should treat themselves and the people around them before going to the doctor for treatment. This is a belief that is passed down from generation to generation and continues to decrease both their physical and mental health. The Irish believe that health and illness is tied to their self-image. Having bad health or seeking medical treatment could negatively impact their image as a hard worker, which a lot of Irish people pride themselves on. Instead, they value the idea of resiliency, that you can bounce back from any ailment without too much help. In a recent study on Irish culture and healthcare, one participant was recorded saying, "You just got on with it and hoped for the best, that you weren't struck down with anything. If you did get sick, God help you." This demonstrates the lack of health care that Irish people tend to seek. Their knowledge of available health services is often negatively impacted due to this belief.